I'm Farah Hudson with Dry Creek Physical Therapy. After pregnancy, we're talking about some different problems that you might be encountering, and some of those things that we're trying to do are flatten our tummies. We're trying to strengthen our core because we might be having back pain. Sometimes you can have stress incontinence, so having difficulty wetting your pants when you jump or when you cough or sneeze suddenly. And also you can have diastasis rectus, which is the rectus muscles that go down the middle start to split apart because of the rapid weight gain or the pregnancy stress on the abdomen. And also you can have organ prolapse, and that's where the uterus or the bladder starts to come down. And so the muscles that we're going to be strengthening today are transverse abdominis, so your lower abs that are like a corset that wrap around your torso right here. And then also the pelvic floor muscles, which are on the bottom, that help hold this pelvic circle together and help hold up the organs. So the basis of any core exercise program after a baby and to return safely to exercise, even if you have diastasis rectus or prolapse, the three basic exercises that you want to do are retraining your transverse abdominis, like we talked about before. And so to find that, you can sit down and you just do some belly breathing. You exhale and you inhale. And when you exhale, you should feel your belly button pulling in towards your spine and just holding in there. You don't want to use your rectus up here. You want to use below your belly button, pulling your belly button up and in towards your spine. So you can do that and hold for 10 seconds and then relax. So if you have trouble finding those muscles, sometimes after pregnancy when they're so stretched out, it's hard to find. So you can lean over and feel your belly button fall down and then pull it up, and then you have that visual, you can see the muscles pull up. So that is your transverse abdominis pulling in. So you can hold that for 10 seconds and you should still be able to breathe. Your transverse abdominis is not attached to your breathing. So you can still inhale and exhale and keep that belly button in towards your spine. So also you want to work on your pelvic floor. So you can, to find your pelvic floor, when you're sitting, you feel like you're trying to lift your pelvic floor up. So it's like you're doing your Kegel, you're stopping the flow of urine, you're pulling up and holding. It's like your zipper up the front. So you can do your pelvic floor and your transverse abdominis together. So you can zip up and lift up from the front and then also pull in your belly button and your spine at the same time, towards your spine at the same time. So try that together. Lift up your pelvic floor and pull your belly button in towards your spine together. And you can try to hold that for 10 seconds. You can still inhale and exhale while you're still holding those muscles. Okay, so if you're still having trouble finding your transverse abdominis, you can do it in laying down too. So you inhale and your belly lifts up, and then you exhale and your belly should fall, and you hold it down. You pull your belly button down towards your spine. So you shouldn't be doing repetitive sit-ups and crunches when you have diastasis rectus or immediately after you have your baby, because you can make that split more. But you can, just in this position, pull your belly button down towards your spine and feel it come down. So we're going to try 10 quick pull down with your transverse abdominis and feel it fall. And you can just feel on the inside of your pelvic bones, feel those muscles contract and relax. And quickly again, pull down and relax, pull down, relax. You can try that with your pelvic floor and your transverse abdominis. So you pull your belly button towards your spine and zip up the front of your pelvic floor at the same time. And you can just try 10 of those. So you can do these in sitting or laying on your back or standing. You can do those all day long, but that's the core of any good core exercise program. That's the basis of any good core program. So if you have been diagnosed with diastasis rectus, or you don't know if you have that split in your muscles, then you should go and see a doctor or a physical therapist to see if that's some problem that you have. If you feel like your organs are falling down and you have an organ prolapse, that's another time to go see the doctor. Also, if you're having pain, a lot of pain in your back, there's a lot of different causes from that, and so it might not only be weakness, and that's a good time to see your physical therapist as well.